Good afternoon and welcome to today's Downtown Rotary meeting. I believe this is our 5th virtual meeting that we have had like this. And we will begin today with the Rotary 4-way test. The Rotary 4-way test of the things we think, say, or do. Number 1, is it the truth? Number 2, is it fair to all concerned? Number 3, will it build goodwill and better friendships? And number 4, will it be beneficial to all concerned? Today at Downtown Rotary, we are pleased to have Mr. Thomas Otten. He is the Vice President of Avera Behavioral Health Center with responsibility for all inpatient and outpatient operations. His role encompasses a lot of things, but mostly strategy, change management, budgeting, and therapeutic programming, of which he'll go into later. Mr. Otten is a native of Sioux Falls. He has a master's degree in educational psychology and counseling and has over 20 years experience with Avera Behavioral Health. He has a heart toward improving access and quality of mental health services for children, individuals, and families. And he's been really instrumental in the development of life-changing programs, including the Family Visitation Center and the Avera Addiction Care Center. He's advocated for the Community Triage Center as a first step toward getting help for substance abuse disorders and has been a champion for the Zero Suicide program that we'll hear more about later. He's a member and volunteer at Linwood Wesleyan Church and is a dedicated husband of 30 years and a father of 5. Tony Knorr is going to lead our conversations today. Thank you, Thomas, for joining us. And Tony, it's all yours.
Thank you, President Jesse. Welcome, fellow Rotarians and other guests today. And I would want to extend a warm welcome to Thomas Otten for joining us today to talk behavioral health, to talk Avera. Given the changes in our world over the last 60 days, we thought this was a timely issue, a timely topic, and we have one of the leaders from Avera that is going to bring us some information today. And I love, Thomas, that you've been with the organization for over 20 years. That allows you a perspective into the history of Avera. And I'd like to start there before we get into day-to-day management today and what you're seeing in today's environment. Let's go back to the beginning. Help us understand history at Avera, the heart of your mission, and how that mission has led to your commitment in behavioral health.
Yeah, thanks, Tony. It's a pleasure to be here. So I'll talk a little bit about, I'll go all the way back to the beginning of Avera Behavioral Health. So in 1958, the sisters began the first behavioral health unit on the 4th floor of McKennan Hospital. And it has been, since that day forward, something the sisters will tell you is instrumental to the care of the whole person, body, mind, and spirit, and something that we would say at Avera, without behavioral health, we would not be complete. I'll fast forward many years, and as we got to about 2003, we started looking at the possibility of decompressing our main campus and what could possibly move off the main campus that we could move somewhere else. And behavioral health was one of those things that rose to the top of possibilities. As we were having those conversations, we were approached by Sioux Valley at the time about the possibility of them getting out of the behavioral health business and selling that to Avera for us to have the community to have one provider. There was a strong feeling at the time, and it's turned out to be very, very true that one really strong behavioral health provider could be the best thing for our community. And it may surprise you to find out that since that day in 2004, when we purchased the Sanford, Sioux Valley at the time, behavioral health, we've had a fantastic working relationship with them. We meet with them on a quarterly basis and have a very, very positive relationship with our friends over at Sanford Behavioral Health. They continue, of course, to do some outpatient business. So then we decided we were already looking at moving off campus. We had to make it an even larger scale. We had probably about 75 or 80% of the community's business at that time, but obviously going to 100% changed the numbers on what this building needed to be at the Behavioral Health Center. So in 2006, this building opened. And the very first meeting we had with the architects to sit down and talk about kind of what we thought the building should have. It was a soybean field at the time, so you could really kind of do whatever structure you wanted. There was no floor plan that we had to follow. And we had a few different ideas. Fred Slenica was our CEO at the time. Dick Molsey, myself, Dr. Stanley, Steve Lindquist, a few of us got together and we had a few ideas we wanted to run by the architects. And they said, no, we don't want to hear any of your ideas. We want to do a design charrette. And at the time I said, you know, this sounds kind of hokey. What's this all about? And they said, we want to know about the values. What do you want people to feel from the minute they come in to the minute they leave, both your patients, their families, your staff, physicians. And so we literally spent the first 8 hours, the whole entire first day, talking about nothing but values. And the 4 things we ended on were, we wanted it to be safe and secure, which of course you want in any psychiatric facility. We did that in a number of different ways throughout the building. We wanted it to have a sense of respect and dignity for a patient population that doesn't always get it. So just like the heart hospital that we're attached to should have a fabulous facility for those who have a heart condition, the behavioral health hospital should have a fabulous facility for those who have a brain condition. And then thirdly, we said we wanted to have a sense of mission. So not a place that would really just focus on the body or even the mind, but body, mind, and spirit, all 3 being really important components. And we did that in a number of different ways, including light and space and color and artwork. All of the artwork, there's 27 pieces of commissioned artwork here. They're all based on Psalms 139, 9 and 10, where it talks about rise on the wings of the dawn, and wherever I go, you are there. And trying to send that message of hope to our patients and their families was really, really important to us. And then fourth, the last value statement we said was we want to have a world-class facility. We want to have one of the best in the world, not just a nice facility in Sioux Falls, South Dakota. We've had hundreds of different psychiatric hospitals have come and toured here. We've had Mark Hovdahl in twice. He's the president of the National Association of Psychiatric Hospitals. His comment was, this building's equal does not exist. It's probably the finest psychiatric facility in the country. So we're super proud of it, super lucky to work in a community that really has this kind of a resource, and for an organization that would really say this is something that is very, very important. It clearly matters when you have a building like this, and when you have the aroma or kind of the environment that we have at Avera Behavioral Health. It's very different than most systems would give to behavioral health, where it's on either the top floor or in the dungeon and kind of out of sight, out of mind. We are taking it on as something very, very important to us.
Yeah. Well, thank you, and well said. A big investment by the sisters, Avera's leadership, 15 plus years ago. Next year, you'll celebrate your 15th anniversary. And thank you for laying that groundwork of that history and how it's all tied to mission, views, and values. Let's before we get into talking about COVID, let's rewind 8 months. Take us back Tuesday, September 10th. What can you tell us about that evening here in Sioux Falls and the days, weeks, and months that followed it?
Yeah. So actually that day is a very memorable day for us. It was a fantastic day early in the day. It was our BHS retreat. So once a year, we get all of our staff together. We offer it 3 different times throughout the day. We offered it 3 different times. We've gone through a retreat, and we've done a couple of things. We started the mission that day with, I talked about Philippians 1, 2 through 6, where it talks about, I thank my God every time I think of you, and he who began a good work in you will carry it on to completion. Having no idea what was going to lie in front of us over the course of the next 8 months. Sorry about that, my phone was ringing. So that was in the morning, and then we also had a video. My bride had put together a wonderful video we put to music, and it was thank you letters from patients about the difference that we had made in their lives. And it's a very strong statement to our staff, an encouragement that you are speaking life into patients. You have an opportunity to change their lives every single day. Fast forward to that evening at 11:23, and you can see the clock behind me is a constant reminder for me. It stays in my office. It's the moment that God placed his hand of protection upon our building. when you walked, so I got a call shortly after 11:23 and said, we've been hit. And I live close to the behavioral health center here. So I drove, and on my way over here, it was like a war zone. There was debris absolutely everywhere. There were cars stalled in the street. There was standing water. It was complex to navigate, even to get to the building. And once you got inside the building, the same thing was true. It honestly looked like nothing I've ever seen before. I mean, the ceiling's gone in big sections. The windows and glass is kind of everywhere. There's wires hanging from the ceiling. So it was a very brief time before I arrived here, but it was already the staff had done a phenomenal job. The first thing they did is through a very short period of time, we heard that there was warnings, and they took all the patients to a central area that was away from all of the windows, and it literally saved lives. If you look at what happened to our building all around, outside of kind of that safe zone or safe area, there was glass walls flying. There was, you can see this on our camera footage. There would have undoubtedly been very serious injuries, if not deaths. And all told, we had 102 patients here that night, and there were very minor injuries. About a handful had to be treated over at the heart hospital, but all of them minor injuries. So after arriving, first thing we had to do is account for all those patients. We knew I ran a census immediately upon arriving, had 102 patients. We went to find all 102 and account for them. They were in grouped areas. Again, the staff had done a fantastic job. And even though in the areas where they were, it was safe and they weren't, there wasn't glass flying around, but there was still, ceilings were down. There was lots of things that had created kind of some turmoil in those areas. So they had moved to a safe spot, and I had talked with the staff on my way over to get that accomplished. When I arrived, we had accounted for those 102 patients and began the process of saying, okay, where can we place these? My first call to the Incident Command Center over at the main campus, we knew we had 14 beds at the main campus available. And so it was going to be a tall order to figure out what we do with 102 patients. A number of different things, and I'll try to be brief, but we did identify. So one thing that was very impressive, during construction, many subcontractors were here within probably a half hour of that tornado hitting, evaluating the damage to the building, saying, hey, how can we help? Making sure that there were that it was safe for us to even be here until we could, get patients into a good spot. We did determine there was one unit that we could sleep some patients on, and then the gymnasium, which is actually kind of sunken in a little below our main floor, was also a safe area. So we had a giant sleepover party for all the child and adolescents. We had 39 kids that day, brought mattresses in and had a big old party there for the kids. Our CEO, Bob Sutton, was here. He ordered pizza for them. And then we had 23 patients that were primarily mental health holds. We tried to maintain here in the building in one unit that was the furthest away from where the tornado hit. The rest of the patients all had to be placed at the main campus. And again, they had 14 beds, but we created spaces as best we could out of some outpatient areas. We had an off-duty officer who lives close to us. Just happened to come by. He said he heard that behavioral health had been hit, and he decided he just needed to be here. He was instrumental in helping us get transportation. So there's a number of amazing stories that happened that night. One I'll speak of, we had one of our nurses in the child unit who had, as the tornado warnings were going off, and if you talk to the staff, they'll say it was like, just an unbelievable roar through the building, almost like it was a bouncy house, that it was on the outside, and you were just, the sound and the fury of that tornado, even though they were within closed doors, was a very loud thing. And we had one nurse who had 4 kids kind of all afraid, kind of up on her lap or right beside her. And during that tornado, when it actually hit, some of the ceiling, as I mentioned earlier, came flying down, and it was flying around, and a big piece of metal went all around them. So they're sitting kind of down, and as the tornado subsides and they look up, they have metal parts just literally all the way around them, about an inch from, didn't touch any of the kids. So really, it's an amazing story of how God protected us, and the staff did a phenomenal job that night.
Yeah, a lot of pride, and I know the response was amazing from your group. And I just thought it'd be important for our audience to hear, as we're going to talk a lot about the current environment. You and the team just are getting back to normal, or we're getting back to normal after the tornado of September 10. And I know you're really proud of that response. And let's segue now to the response of today's environment. And we'll talk behavioral health, but before we do that, let's look at a global level for Avera, the health system. Your oversight, and for those just joining us, we have Thomas Otten, who leads behavioral health for both inpatient, outpatient for the network here in Sioux Falls and surrounding areas. But let's talk about that purview beyond mental health. When you look out over the system, talk about your experience to date over the last 50 to 60 days, what that's looked like, the preparation for the surge, and your philosophy moving forward.
Yeah. I'm going to go back to the last one just because I'll be remiss if I forget to say one of the most amazing parts of that is that night of the tornado, we contacted Human Services Center administrator and the secretary, and they were extremely gracious to allow us to use Human Services Center, had empty units. It was phenomenal, the partnership that we had with them, and we owe them a great debt of gratitude. We should all be very proud to work in a state that partners the way our state did that night. And I'm super proud of Avera and the way they set up a hospital, 90 miles away, literally in one night. That night by 7 p.m., we had patients down there. Peter Druckers has famously said the most complex organization in the world is a hospital. For Avera to have set that up in less than 24 hours is a remarkable thing. I'll skip to COVID, though. It's a great question. And really, our efforts on COVID, I would say, began at the very end of December. We put together a first task force to kind of look at COVID and kind of what was going on with Corona at that time. Obviously, it ramps up considerably in early March as it hits South Dakota. There's a number of different things that went into play. Certainly conserving PPE, we stopped elective surgeries. Certainly we began limiting visitors to almost no visitors. The only exceptions really to that even today are with pediatrics, where we have limited visitation in our pediatric areas, both the behavioral health and the main campus. There's been a whirlwind of testing and activity. Department of two sites that I'll reference for South Dakota Department of Health website is fantastic. Gives all kinds of updated data on Corona, literally day to day it updates. And then from a national perspective, I happen to like the John Hopkins site, very informative as well. Gives a lot of good information. But in the state of South Dakota thus far, there's been about 16,000 tests. As you're well aware, we're not the people that are being tested would be those that are at high risk. So they've either got symptoms, they've had very known exposures, they've traveled to places where there would be very significant concerns. Of those 16,000, about 2,600 in our state have been positive for COVID. About 1,800 of those are fully recovered. So that's really good news. And a couple hundred, I think it's about 200, have been hospitalized at some time. Here at Avera, probably take all those numbers and probably about 2/3 of that is happening at Avera somewhere. Obviously, the most of that is at Avera McKinnon here, but lots of Averas throughout the state are doing testing and a variety of other things. So I think that gives kind of a ballpark for testing. I would say the philosophy we've had at Avera, and I think partnering with the city and our community has really been, let's plan for the worst and hope for the best. And I think it's still too early to say where we're at in that. Obviously, there's some very good signs. As we've looked at the surge numbers over and over, and we've continued to do the modeling, the numbers have gotten smaller, and that's a really good thing, not only for our country, but for our state. The numbers are much smaller, and has to do a lot of different things. Certainly, the mitigation efforts we've done with social distancing and some of the pieces we've done have been instrumental in making that surge number smaller. So we are continuing to do just that. We're planning for the worst and hoping for the best. We are encouraged by some of the signs that we see, but I think it is too early to say exactly what's going to happen. You probably heard, but we did set up a second testing site that's specific to the Smithfield employees and people living in the homes with them. So I think you could expect the numbers in South Dakota for testing and positive cases is likely to go up in the very near future. But that's a very good thing for us to identify them and kind of figure out where that's at and make sure that we're keeping people quarantined that need to be quarantined.
Yeah, well, thank you for providing that background or that global perspective for Avera and providing hope. There's a lot of negativity out there. It's great to know that our health systems are working around the clock to make sure we're best positioned for this moving forward. Because, like you said, there's still a number of things that we need to learn, and we will learn here as we work through this. Let's now move, Thomas, to behavioral health. We talked about it earlier, coming up on 15 years in the new building, but history goes back well beyond that. And you've been with this effort for over 20 years. Let's talk about behavioral health even before mid-March, before the last 60 days. Share with us what that normal reach or that normal relationship was with your patients and the care that you provided, even before the change that we've seen here most recently.
Yeah. So we have a full continuum of services in behavioral health. Obviously, most people are probably familiar with our inpatient programs. We have 6 inpatient programs, one for child that's 4 to 12-year-olds, adolescents, 12 to 18-year-olds. We have 3 different adult programs based on kind of the acuity of the patient. And then we have a geriatric psychiatric program. All told, it's 122 inpatient beds, which is one of the largest inpatient facilities in our region for sure, or is the largest in our region. Some of those units are unique. Geriatrics and child in particular are pretty unique. There probably aren't more than 50 child programs that would treat kids that young in the country. Geriatrics is another one that I would say is relatively unique to have something very specific for that aged population. Also on that continuum, though, we have a lot of other pieces. We have a partial hospital program where people will come to services all day long but go home in the evenings. We have intensive outpatient program that might be 9 or 10 hours a week. And then we have a lot of just traditional counseling and traditional psychiatry, where you may see your counselor once a week, or you may see your psychiatrist once every quarter. And all of that part of that continuum has been an important component for Avera. On the inpatient side, we have about, if you go back prior to tornado, this has been a very unique year. Obviously, we've been without a lot of our beds, just as you made reference to. We're just now getting back up. Actually, today is the day that we'll have our 5th unit up and operational. So the last of the units in this building. Prince of Peace is actually over at our senior program is over at the Prince of Peace campus. So that's where our 6th unit is. It's moved back right now, but we'll be moving it back once this COVID piece is over. So during a normal year, we would have about 6,400 admissions to our inpatient program. We'd have probably over 100,000 visits to our outpatient programs. So a very large reach. For the inpatient side, again, depends a little bit on which unit you're talking about, but it's at least a 3-hour reach, kind of any direction. Some of those programs, like child, certainly Mayo would send their kids our way. Rapid City, if they have younger kids, would send them our way. So it goes even beyond 3 hours if you get into some of those populations. 122 beds total right now. as I think I made reference to.
Yeah. Well, thank you. I think it's important for the audience to fully understand, and I know a lot of us do, the impact you're making over the last, you said 1958, over the last 60 plus years, the last 14 years at your current location at 69th and Louise. Then let's talk about, and a big part of the reason we wanted to have you join us today, Thomas, was in the current environment. There's different stressors in our lives. There's things are changing rapidly. The environment is changing. Help us understand how you and the team have had to evolve, what you're seeing in terms of trends over the last 45 to 60 days.
Yeah, great question. So a couple different things. I'll start with the outpatient world. So in the outpatient world at Avera, we took our clinics to a level where we're only seeing urgent and emergent patients. And so what that means for a lot of our clinics, including our psychiatry clinics and our behavioral health counseling psychology areas, a lot of our visits moved from in-person to virtual. So there's been a tremendous amount of learning. We've had Avera now available for a long time, but we've never used near the level of virtual visits that we're doing now. We're doing over 1,000 virtual visits every day. That was definitely not at those numbers prior to this COVID thing. And I do think, a friend of mine has told me after the tornado, don't waste a crisis. Make sure that you learn from it. And I think we'll do the same things with this COVID, that there will be learnings that we'll take from this that will be very valuable for us. As far as a testing piece from a screening at behavioral health, similar to virtually every healthcare area you go into now, we screen at the door, asking the symptomology that you've had, if any. We're taking temperatures, trying to make sure that we are doing the best we can to make sure that we don't create an outbreak inside of the hospital. All of our staff have moved to using personal protective equipment at all times. We are at behavioral health using cloth masks for our patients, particularly in the adult populations. And again, it's things that we're just having to adjust to and get used to as we kind of go along. The other part, and I think we've been partnering with the helpline. So one of the things that, just as you identified, these are unusual times. There are definitely additional stressors that are going on. So we talked about, Avera, could we create a COVID stress hotline? And I contacted Janet over at the helpline and just talked about, is that something that would be a need in our community? And they are answering not only their own phones, but the state has a COVID hotline. And they were just looking at the possibility of opening it further beyond just like basic needs of I need food or I need to know what to do for testing, and broaden that into a stress hotline. So we created a partnership with them that's been fantastic. So they'll take the 211 still remains kind of that entry point. They take the calls. If they get into a situation, it's a caller who just needs help with stress, or to learn a relaxation technique, or to just talk to someone, or to set up counseling. Any of those pieces, they will refer that on. They'll transfer it over to one of our counselors or mental health professionals. And then we can assist with that and make sure that we meet their needs, not only on that call, but if they have ongoing needs, to meet those as well.
Yeah, well, thank you. You brought up partnerships earlier, another example of partnerships. So thank you for your work with the 211 and the Helpline Center. Locally, and we talked about it earlier, most agree that South Dakota has yet to hit its peak. We're already dealing with increased anxiety, different challenges. But my question is, Avera as a leader on a national level in behavioral health, what have you been able to learn from your counterparts throughout the country that maybe have surged or seen more significant impacts when it comes to financial stressors, the other challenges that this pandemic has presented?
Yeah. So a couple of different things that I'll focus on. One, certainly this is held true for us. Our volumes right now are lower than would be expected, not only at the main campus, but also at behavioral health. Probably for a variety of reasons. One, we've mentioned already, there is fear. You know, and while we are desperately seeking hope in our world, the fear remains a very big motivator for some people. And now I think, you know, again, just as I talked about, we're using masks, not only for our staff, but for our patients. There's probably not reason to be afraid to come to the hospital, but at the same time, it's a real thing. Secondly, there are some financial issues. You know, as you're well aware, people throughout our community have been furloughed or have lost their jobs, or the layoffs. You know, if you worked at the Empire Mall, suddenly you're without work. And there's a financial reality to, you know, seeking care right now is really hard to do. And a third reality is as we're more isolated, there aren't people recognizing those who need help. I'll give you a classic example would be school. You know, we get a tremendous number of referrals from school counselors and teachers and principals. And when school went, you know, closed down and went online, suddenly those contacts were much, much less. And so, you know, it's very understandable why we've had less. What we've talked to others, so we're a part of a group called Harbor Performance Initiative, made up of about 25 different elite psychiatric programs throughout the country. And some of them are in New York and New Jersey and a variety of different places that have had their peak. And we've learned a couple of different things I think is really critical. One was just what I talked about before with masking, cloth masking of patients. They said, you know, what they missed on was understanding that if you mask patients quick enough, early enough in this process, you can stop outbreaks from happening on your unit. And it unfortunately happened to them. We've learned from that, and it's been a great resource for us. The other thing that we've learned, and this is not necessarily specific to behavioral health, but the emotional toil. They were talking particularly about ER. They were prepared for the surge. They were prepared in every way. They had created more rooms, but the emotional toil that it takes on an individual to go through, you know, seeing people come in such desperate need and death after death after death. Now, we hope and pray that never comes to Sioux Falls. We believe that we've done a lot of different things that will help with some of that. Certainly, the social distancing and the mitigation efforts that we've had here and the fact that we're rural is definitely going to help us. Another thing at Avera that we've done that I'd say is a huge win is we've, as much as possible, tried to manage patients on an outpatient basis. So we very quickly set up an Avera at-home COVID team, and we're managing more patients at that Avera at-home COVID team than we are in the inpatient side by quite a bit. And that does a great benefit to our community to make sure that we utilize the resources properly.
Yeah, and thank you for bringing that up. You talked about the team that's working with outpatient population, and it's no secret that Avera has been a leader in delivering e-care. Help us understand why this has been so important as we've gone to, as you mentioned, social distancing, and then also I think a second part of that, talk about, despite that technology, what challenges do you continue to face when you're trying to provide care to those that need it most?
Yeah. So you're right. E-care has been a strength of Avera's for a very long time, and we're super proud of that. And in this environment, it gave us a definite easy path, if you will, for that 1,000 virtual visits. It probably would not have been possible had we not had, you know, the benefit of e-care. There does remain, and I'll give you an example. We're looking right now. One thing we'd like to do is keep behavioral health psychiatric patients that need an ED out of the main campus ED or the heart hospital ED if we can. We're looking right now at a plan of how do we partner to do that, maybe through an E-system, having the nurse here and the counselor here, but maybe bringing in a physician via E. And that will create, you know, again, a safety not only for our patients, but for the patients that are there. So the E has been a blessing to us for sure. it continues to have challenges. I mean, I'll say one of the challenges, and I don't know if everybody would agree with this, but I just read an article about the exhaustion that this pace has for people. It's a different pace, but doing all your visits virtually without having that human connection quite the same level as you do when you sit around a conference table and talk, or when you sit one-on-one with people. It is a different toll that it takes on people. And so the importance of kind of recognizing what that is and how we treat that is very, very important.
Yeah, let's go a little deeper into that. Is you referenced it, whether it's exhaustion, isolation, loneliness. The current environment has required a level of distancing that we're not accustomed to. You talk about what your providers are seeing, the challenges they're facing moving forward, especially in an environment where we don't exactly know how long this is going to last.
Yeah, it's the only way to say what's going to happen in the future is we know who holds the future, but honestly, none of us have a very good idea of what's going to happen. And if somebody tells you they do, they're probably fooling themselves. And so we do think this is going to be around for a while, but I'm like everybody else. I'm guessing more than I know anything. And so we do have to figure out what that looks like or how we handle this going forward on a day-to-day basis. Now, it's as I've mentioned, in our state, things are looking brighter for sure, and things have definitely, the numbers that are planned for a surge is not looking as concerning. That doesn't mean, though, that all the problems that we've had with behavioral health previous, our normal census is lower. According to all those things I just told you, for those reasons, those patients, I am 100% convinced, are still in need. And when this starts to lighten and when we start to feel a little more open and quarantine is less and less a thing, I am fully convinced that beyond what the main campus surge of COVID patients may be, there will be a surge of behavioral health patients that will be coming just because all the problems we're dealing with. Trauma didn't go away because of what's happening right now. In fact, a lot of people are experiencing new traumas. People are experiencing new griefs, and they can't reach out to get the same level of care and support that they did in the past. I'll just on a very personal level, my father, whom I love dearly, passed away just a few weeks ago, and the funeral was a very different thing than it would have been had we had the opportunity to have a visitation service and hug and talk with others. And so it is definitely something we have to be very cognizant of. I think it's something for all of us to pay very close attention to. If there are people hurting, and if it's not you, I'll guarantee you know somebody who is. Make sure that we reach out to them, that we help them, encourage them to get the right resources that they need. And I can certainly talk about what those resources would be here at Avera.
Yeah. Well, thank you, Thomas, and sorry for your loss, but you're absolutely right. The grieving process is different for those today. For those that are suffering in a hospital or a nursing home setting, having to do that without their loved ones around are challenges that are a reality today. Let's talk about another investment that Avera made here within the last year. You opened up an the addiction care center just about a half mile down the road from your office there. Talk to us about the opportunities, the challenges of those that are facing addiction in this environment, and what Avera has done to respond to that.
Yeah. So you're right. December 9th was our first day of opening the Addiction Care Center. Thankfully, it was not hit by the tornado. We were definitely under construction at that point. Unfortunately, all of our cabinetry was hit by a flood that happened in Mitchell. So we got pushed back a little bit, but we opened on December 9th. And we really did that same process of a design charrette at the addiction care that we did here. We sat down with a group of community members that were very vested in this, either through their own story of recovery and addiction or a family members, and then several different people again from Avera sat down with the architects and did that same concept. And we really ended that time with three different values. Confidence was the first. We really wanted to be, from the moment I drive up, that I look at this is a facility, just from a facility standpoint, that says, hey, I can get better here, that this is something that I matter. It's not a second class kind of facility. It's a very, if you've seen it, it's very, very nice, and the amenities there are very, very nice. The second thing, similar to here, we said respect. It's critically important that we look at this not as a character flaw, but as a disease. Addiction is just that. And I promise you, if it's not you, you know somebody who has struggled with an addiction. And if you think about it, it really is a disease that we have to treat. And it's got very good treatment methods available to it. And then the last thing we said in our design sure at that time was we wanted it to be a place of hope. And we know from the scriptures that hope does not disappoint. And so it's critically important that every patient that walks in and every patient that ends up walking out, that they have hope that this is a do-over. They can have a new lease on life, that it doesn't have to be the way it was the day that they entered our program. And so this is a unique time to get addiction care. Honestly, a 28-day program like we are set up, and it's not that everybody stays exactly 28 days. Some are a few more, some are a few less, but a long-term treatment program like that, when there is a quarantine in the country, it's a perfect time in some respects to get clean and sober. We do know that alcohol sales in March and April are up 55% from what they were previously. So there are people turning to the wrong answers during this time, and when they're at home, it can become very problematic. So it just like I said for behavioral health, I would say the same thing here. If you know somebody who needs help, please encourage them to get that help. We have done a number of different things at the addiction care, similar to here, where we really had to limit visitors. We've really got innovative with Zoom visitation. We've had to do a variety of different things around masking and the same things that you'll see other places. We really had to kind of create that same thing. We are doing testing just like we do here on patients. Not every patient, but again, based on kind of what their symptomology and their pattern might be of exposures. We do the same thing at the addiction care center to make sure that nobody in either of those environments, behavioral health or addiction, we really have kind of a communal living where we eat meals together. We go to groups together. There is a variety of places where that would an outbreak in one of those areas would be very, very problematic.
Yeah. Well, thank you. And thank you to Avera for that investment in addiction care. Talk about, we've talked about addiction, we've talked about isolation, loneliness, and some of the potential outcomes there or symptoms of that in terms of anxiety and depression. Talk about looking ahead. You talked about the census being lower now, but the potential for that increasing in the days and weeks and months ahead. Talk about your preparedness and our preparedness as a community looking forward.
Yeah. So I think we've had the great benefit of having opportunity to prepare. And I'd say we've done that very, very well. Again, we should all be very proud of the healthcare organizations here, both working together along with the city and state to make sure that we're prepared for the surge that will come if it comes. And again, the philosophy of plan for the worst and hope for the best is in full effect. I do think we're very prepared because we've had that time. We've set up additional facilities where we have the ability to care for patients. So we're very prepared for any COVID surge that would hit. And I probably should give the caveat, probably not be the right word there, because as I said before, none of us know exactly how this is going to go. But I think we're as prepared as you could possibly be for a COVID surge to occur. I think in behavioral health, I would say the same thing. We're extremely prepared for a surge that may come. Where I do think, though, we may not be prepared for, and this would be true 6 months ago or a year ago or 2 years ago. We are constantly looking at, do we have enough capacity, particularly in our child adolescents in the behavioral health world? We've looked at, over the course of the last couple of years, we've had to divert patients to other facilities who needed psychiatric care. And I'm telling you, when you have a parent bring their 16-year-old in who's going through something very difficult, the worst thing in their life, and they're talking about killing themselves, it's almost impossible to say there's no room in them.
Yeah.
But that's the difficult thing we've had to do. So we're actively looking at, do we need to expand services for additional behavioral health beds for kids, where we could really create, instead of just 2 units, a child unit and an adolescent unit, almost a tweener unit, if you will. So you've got elementary kids, you got middle school kids, and you got high school kids, all of them very, very different issues. Even if you think about what we have, a 4-year-old's needs and an 11-year-old's needs are very, very different, as a 12-year-old and a 17-year-old's needs are very different. So that would be very innovative. I think it'd be something that would be cool for our community. The other thing I think of it with kids is addiction. So when we built the Addiction Care Center, I've had the question asked dozens of times, will you take adolescents? Or if it's not now, when can you take adolescents? And that same scenario plays out, that, if it's your 17-year-old who's got an addiction problem, to have that available in our community would be a very, very positive thing. To have a world-class facility that could really treat addiction, again, not as a character flaw, but as a disease, I think would be something very, very powerful. So we continue to plan for that. We continue to look at that. And I think that's on our long-term horizon for sure.
Yeah. Well, thank you. Yeah. Thank you for sharing that as to where we're at today and where Avera could potentially lead. Because as you mentioned, when it comes to kids, assuming they're able to go back at the end of August, it's going to be a period of 5 to 6 months where they haven't had the same level of interaction, the support structure of a school, and what that brings for our community. We're grateful that Avera and your team are there and preparing for helping kids through. Let's talk about, we talked about a number of investments. Let's talk about another partnership that you had brought up in a previous conversation down in Yankton. I know you're looking at further preparations. Help us understand that partnership and any other partnerships that Avera is working through right now.
Yeah. So Yankton and the state have been fantastic partners throughout the tornado, as I mentioned before. Jeremy Johnson is their administrator there, and we've had multiple conversations now about the COVID piece. We continue to have conversation and ongoing discussion. One of the things that I think is unique in our state that we're planning for right now is a COVID positive unit of psychiatric patients. So, certainly some behavioral health patients can be managed maybe on a medical floor. But if the psychiatric issue is the real primary issue, whether that's schizophrenia or psychosis or acutely suicidal, I think any of those issues are best handled on a psychiatric unit. And so we're in partnership right now with the state on conversations about HSC having a COVID positive unit that would be jointly staffed with our staff as well as their staff. We've asked for volunteers from our staff who would work in that environment, and I'm very proud to report we had a number of staff step up and say they'd be willing to do that. And HSC has done the same thing and have a number of staff that would work there. Now, to date, we've had a couple of patients in that unit for testing that were suspected COVID, but we have not had any COVID positive inpatients that needed to be in a psychiatric unit. So that partnership continues to go on. We mentioned before the Addiction Care Center, definitely a partnership that we had with our community. The challenge that was given to me by our previous CEO, along with a few others, is we had to raise $1 million of philanthropy before we could build it. Obviously, behavioral health and addiction care is not one of those areas that's like surgery or maybe some other areas where there's lots and lots of profit margin. So we had to do a lot of philanthropy. We partnered with a number of community members And we really, at Avera, I'd say we continue to see partnership as a really important path. We're partnering with the city now on this response. We're partnering with the county. We're partnering with the state. Any area where we can. Farm stress would be another one. You're probably familiar with that farm stress hotline that we've been working in collaboration with the state for well over a year now. And while those calls were less and less over the winter months, they've started to pick up again. And now on top of the regular farm stress issues, the COVID farm issues, with hog producers literally having to kill their hogs, there's additional financial stressors. There's additional stressors that are really hitting that it's a critical time for us to make partnerships to see how we can help our community best.
Well said, and that's been one of our strengths in Sioux Falls and throughout the state, and it's great to hear. And for those that have joined us recently, we have Thomas Otten, who oversees Avera Behavioral Health, with us here this afternoon, and we're just a couple more questions for you, and thank you for all this good information. Thomas, for many of us at some point in our life, either ourselves have suffered from some sort of mental health condition, or someone in our very close to us has. What can you tell us about the resources out there today for those out there that are hurting?
Yeah, it reminds me, I'll answer your question in just a moment, but you just reminded me of a story that I think it's a short story. I'll try to tell it quickly, but it's worth telling you. One of the things at Avera Behavioral Health that we really pride ourselves on or enjoy is the arts in healing. So we try to use arts as best we can, whether it be, art or music or dance or movement or a variety of different things. Probably going all the way back to David playing for Saul. It can really soothe the soul of someone who's troubled. And so we use music when we can. We bring in artists all the time to play for our patients. And the story that happened here several years ago, but one of the artists who came in and he played for the patients, at the end of the playing for him, he said, "Hey, could I donate this guitar so that if people here ever have musically talents, and that's something that helps them, that they could use the guitar under supervision." And we said, "Oh, that'd be fantastic." So he wrote on the guitar, "Never be afraid to believe," and signed his name. And it was not more than a few days later, a patient comes in who was going through the worst time of his life. His wife had just left him. He didn't know exactly why. I couldn't tell you all the details behind what had happened, but his entire mantra at that time was, my wife has left me, my life is over. How can I believe in a God who would let this happen to me? And just ironically, he was or I would probably say not ironically, probably God ordained, within a few days of us getting that guitar, he had asked about, if we had such a resource, is there anything he could do? He liked to play guitar, and we gave him the guitar. And, he picked up the guitar and he reads on the guitar, "Never be afraid to believe," which just the power of that moment and how God can use people to change lives is a powerful thing. So, sorry, I'll get back to your question. Your question of what are the resources that are out there. I'll make it really simple. Probably the easiest resource to use is we have an assessment program, 24 hours a day, 7 days a week, 365 days a year. Here in town, it's 322-4065, an 800 number of 1-800-691-4336. We do free mental health assessments 24 hours a day, 7 days a week. So we will do that either over the phone or typically in person, although we're doing more and more virtually and over the phone recently. We will do that free mental health assessment and then help you determine kind of what the next step should be. If it's setting you up with a counselor, we'll try to make that happen. If it's setting you up with psychiatry because you need medications, we'll try to make that happen. If it's needing inpatient, we'll certainly work with a psychiatrist to get the physician to order that, and then we would work with the insurance company to help if one exists. So we are available anytime for people to reach out to. And I think that's probably the easiest resource for people to remember.
Yeah. Well, thank you, Thomas. And audience can clearly see your passion for helping those exactly where they're at. For those in our audience today that might want to help further or get involved or support your mission, help us understand what that might look like.
Yeah. Great question. Thanks for asking that. We have an annual fundraiser every year. It's called the Hearts and Healing. It's in February. It's our one fundraising event where we try to raise dollars for behavioral health. And it is a fabulous evening. We'll have a story of hope. Every year we'll have one patient come and talk about how behavioral health impacted their life. We'll have a Heart of Behavioral Health Award winner. Each year it's given to somebody who's made a big difference. This last year we actually had 42 winners. It was the people that were in the building the day the tornado hit. And that is, those funds are used in a number of different ways. It's part of what funds those free mental health assessments that we do. It's part of what helped us get the Addiction Care Center underway. And then it helps with patient needs if they just need medications for a short period of time, or they need transportation back to their home, or a variety of different things that can help with all of those things. And then obviously, as I mentioned before, we're hoping someday to have a fourth wing. If anybody is interested in our mission, I would encourage them to reach out. We would love to talk to you. And lastly, I would say, as I've said a couple of times, I would just strongly encourage you. One way you can help us is encourage people who are hurting to reach out for help, making sure that they get the help they need. Behavioral health conditions are incredibly treatable. If cancer had the treatment effectiveness that behavioral health had, we would be, it would be shouted from the mountaintops. So if people reach out, the real problem we run into is there's a stigma, whether we like it or not. So many people are reticent to reach out. So encouraging them to reach out as a sign of strength is a very powerful thing.
Yeah, thank you for bringing that up. Whether it's ourselves or someone we love, this is a time when, like you mentioned earlier, unprecedented times, different stressors in our lives. So a time to not be bashful, to raise your hand, ask for help, and Avera is there to answer the call. So I want to thank you, Thomas, for joining us today and your commitment to service, not only at Avera, but within our community. I speak for all Rotarians when I say around the world, when I say that we're going to get through this together. Anything that you'd like to say as we wrap up our time together?
Yeah, I just say it's been my distinct pleasure. Thank you for taking on this issue and inviting me to talk on these things. This week actually starts Hospital Week. Starting Wednesday, it will be Nurses Week. So remember to thank those who are out there on the front lines, taking care of all of us. And just as you said, I think we have a lot to be hopeful in our community. We have a fantastic city.
Yeah. Well, thank you for joining us today and sharing that message of hope.
My pleasure.
Very much appreciated. Thanks.